Welcome back. Governor Brad Little announced today that Idaho is on the brink of a statewide health care crisis. Little says this means Idahoans could receive a lesser standard of care or may be turned away from a hospital altogether. Little also announced today he plans to activate the National Guard and direct hundreds of medical workers to help overwhelmed Idaho hospitals. Our Andrew Bartline listened in on the governor's announcement today. Andrew, what are the finer details of the governor's plan and why now? Why talk about this now?
Yeah, Kim, Governor Little's office says nearly all Idaho hospitals are overwhelmed, and there are more Idahoans in the ICU with COVID than ever before. Little plans to address this by adding 370 additional workers to assist hospitals with this surge of hospitalizations. That means 150 guardsmen from the Idaho National Guard will support short-staffed medical facilities. 200 additional medical administrative personnel will be available to Idaho, and a 20-person Department of Defense medical response team will be deployed to North Idaho. Little says that's where vaccination rates are some of the lowest in the state.
More Idahoans in the ICU with COVID-19 than ever before. The vast majority of them are unvaccinated. On a daily call with hospitals this morning, we heard there are only 4 adult ICU beds available in the entire state, out of close to 400. Where hospitals have converted other spaces to be used as contingency ICU beds, those are filling up too.
Little says he will also direct funds to help Idaho hospitals. This money is intended to attract and retain medical staff. Little is also waiving temporary licensing fees for retired and inactive nurses. This is so people can more easily re-enter the workforce. Little's office says waiving fees last year allowed more than 1,000 nurses and other healthcare professionals to come out and help when needed. Little says he hopes that this is enough to prevent crisis standards of care, but added the best tool out of the pandemic is the vaccine. He says more Idahoans need to choose to get vaccinated. And coming up at 6, we'll hear from the Idaho Department of Health and Welfare and how these direct funds to hospitals will be divided up.
I want to add one more thing that Little said. I was listening in. He talked about how he recently toured an ICU facility at a hospital here in Boise and said he was heartbroken by what he saw. So some strong words of warning really coming from the governor today. Andrew, thank you.